So what is voice therapy? Okay, all read. It is fine. So it is nothing but a non-surgical technique. Okay. Surgical person is there. We are non-surgical. And for whom we will do this voice therapy? Who have voice problem and you can read, no problem. Read and tell. Like whom we will give voice management. After surgery, one then before surgery, yes. And where you cannot do surgical management. And some disorders are there where you no need surgery also with voice therapy you will able to cure them. So surgery is not primary for us. Like who will prefer surgery? Will you prefer surgery or non-surgery? Non-surgery. When we are failing, then we can send them for surgery. It's not only surgery, then they will come to us. So it is also important to recognize that there are differing approaches implemented for various disorders based on their own individual assumption concerning the disorders. So it is not just one, there are different ways. Okay, different kind of management. Like Faninder sir was telling, primary problem will be there, one secondary will be different. We should know which is the root cause. First, basic cause is what? Then we should start focusing on the management part. So this is your answer. Voice therapy is a kind of technique that changes voice in a behavioral way. Is it true? No. Yes. There are some therapists who will squeeze your vocal cord, who will make you to do push-up. Okay. So these are all not voice therapy. This is very simple. It will concerning to your behavioral way. Clear? So according to Aronson, voice therapy may be defined as an effort to return the voice to a level of adequacy. Adequacy is what? Your normal level. So different goals for voice therapy. Can anyone read loud? Should I put names? I know most of you. Yeah. No. Yeah. Any doubt in any of that? You have any doubt in any of that? It may not come, sir. General. Last one. See, enable patient to reach vocal potential and assist in communication adjustment in irreversible conditions. Irreversible means what? Which cannot be reversed. For example, there is a patient with laryngectomy. We will not be able to reverse their voice. Can we do it? We can give them a basic communication voice, not more than that. So in those conditions, we are not able to reverse it to a normal condition. Clear? Ma'am, it is fine? Yes. Okay. Next, what are the principles of voice therapy? I think some students should read this. Shushoman. Okay. Any doubt in any of this? Yeah, see, actually, we had a patient last 2 weeks back. So the patient came with complaint of poor loudness. So he went to some particular XYZ therapist. He took speech therapy for 3 years. So the cause is loudness, but whatever therapy or techniques they did, we don't know. But he came with the only aim that I need surgery. I am not ready for speech therapy. So if he could have that patient like 3 years voice therapy, I don't think any patient is required. So those places, like actual problem him for the patient was psychogenic voice disorder, where the role of voice therapist only not there. It should be sent to a psychologist. But 3 years taking therapy, and there is zero improvement. So these things should not be there. So if you are like you know the anatomy, you know the physiology, you know the correct diagnosis, then I think the improvement will be in short period. If it is not, you can refer to the ENT for other procedures.
What is the minimum time do you think they require for improvement
Two
for
to three
any
months,
sorts of any sort of voice intervention if you do?
basically 2 to 3 months is enough, sir. Even before also. Yeah.
So what is
Severity, like
uh,
puberphonia is there.
yes.
I think not more than 5 sessions is required for puberphonia. Two, they adapted very fast, that change. Normally 5 session, 2 session they will take, another 2 session for adaptation. So normally, yeah, not required or
If it's
you
not
should,
developing, probably there is something else that we have to
yeah,
do.
we
Yes.
have to refer to ENT. Any other in this? Why holistic? I just told you. Patient problem is psychogenic. Whatever we do, is there any use? No. Understood. Even the ENT will not be able to do.
Nothing. The holistic means involving everyone
Everyone
for
in
the
that.
patient's cause. That's it.
So in your books, you will not see. You have psychogenic voice disorder, but you will not see the role of psychologist anywhere. So the patient, when we did psychological evaluation, it is severe depression, severe anxiety. Multidisciplinary team. Like for laryngectomy, all this we need a multidisciplinary team. Like even the nurse, even the social worker is required. Yes. All neurogenic conditions, there is a requirement. So now I'll start with vocal hygiene. We'll run fast. What is vocal hygiene? Yeah. Do's and don'ts. So fast.
Voice.
I'll read. To do hydration. What is hydration? Water. So how it will reduce or supply of water will be affected? Not scientifically. Like when you, for like what all reasons where your hydration will be affected in your body. Like, uh, see now I have less hydration. What are the different ways it is getting hydrated?
Our throat is getting
Yeah.
hydrated.
Yeah, that is one. Other than that, then
Breathing itself causes loss of lot of
yeah.
water in the brain.
Then yes. Then there are many things. Can you come up?
Environmental causes.
Yeah. Like smoking, drinking, all this, will it affect or not?
Daily habits.
Spicy food,
Spicy food. Yes.
that I think Hyderabad everyone will do.
Yes.
Traffic pollution. So, yeah, these all will affect what? Hydration. Then voice rest. Why it is important? Say, yeah. So will it improve or will it reduce? All of you take rest after running or walking, going up in the stair, or you will try think about climbing again. No. So rest is mandatory even for your vocal cord. Steam, steaming will do nothing much. Hydration level will be maintained. That's it.
No,
Yeah.
not fomenting. Doing that, it comes easily.
And not with any this one like People will tell, no, you should put some medicine, all this thing, no.
Put only with turmeric only.
No need that, only water, plain water. Then adequate sleep,
Yes, yes, yes.
why? Again, it is related to second one,
Voice, yes.
voice rest.
Body rest,
Uh,
adequate sleep.
yeah. Take enough breathe while speaking. Okay. Things to avoid, throat clearing, then caffeine and alcohol, smoking, chemical irritants, then gastric reflex. On to that, there are few more in vocal hygiene. One is you should not reduce your voice or you should not increase your voice. Understood? Why you should not reduce? All of you think that you have a height. Think I am bending now. That means I am reducing my height and walking. Is it normal flow or is it effortful? So if I am reducing my voice also, you are putting some effort. Understood? Now I am trying to increase my voice. Is it again effortful or normal? Effortful. So you should not increase your voice, decrease, whether it is good or bad. We have a feeling when you talk low, it will be better. No. You should, because your vocal cord is habituated to a normal pitch. So you should not decrease it or you should not increase.
So, but for caffeine alone, practically I have not found an answer. Because I'm a coffee lover, basically, and most of the South Indian singers are basically, they are filter coffee lovers.
Yeah.
So, till now, I have never faced any explicit issues because of caffeine.
Man, this caffeine problem, when you see Europeans, they will go for this black coffee
Espresso,
and double,
double
not
espresso.
one, double special. So there, they are not pouring much milk or water.
Okay. So, milk coffee is like koncham permissible.
Better. You are diluting it, no?
And probably, I don't know, you might have only one coffee. People like us might have
Yeah.
four to six coffees in a day.
I have been like that also.
Yeah,
I've been on coffees because it keeps me awake, the caffeine.
Therapies. So this is for your
Coffee
exam.
is a legal statement.
Okay.
Brushing my face is.
So you have indirect voice therapy and you have direct. So what is indirect? See last line. Normal vocal anatomy and physiology, vocal care and vocal hygiene. So you are not putting pressing, you are not giving any stress, anything. You are using all other measures to make your vocal cord free. That is indirect. When it comes to direct, what? Yeah, you are giving some kind of exercise where it directly affects the vocal cord. Clear? So this
Mr.
direct,
Gish, one small this one. Except digital manipulation, does any other technique requires you to manipulate the
no
throat?
sir.
Huh?
Only vocal massage also we give. Other
Uh-huh.
than that, nothing.
Nothing, no.
No.
So digital manipulation itself is that a part of that one.
No, but again, like yarn saying, boom, all this, you are indirectly evoking the vocal cord.
But you don't do a direct
No,
touching.
I mean physical touch is not there.
That's what I'm telling. Yes,
Yeah.
yes.
You will see someone doing pressing all this. Don't go for that. It is all fake. Nothing.
It's just a temporary thing.
We don't know what is their philosophy.
Yeah. Only patient should know.
It's a test for puberphone. How we like.
That is also very
There's a
gentle.
test.
Not
It's
necessary,
gentle
sir.
test.
Yeah.
Just
Not necessary. That
also.
also,
Yeah.
that also not necessary. No,
Show
initially,
them one just to diagnose. Just to show them
initially we used to do that.
Sustain. And slowly what you will do again. All techniques will start from one vowel or one syllable and you will start making it till sentence. So ma, then you will prolong it till a word. Understood? So that is how like voice technique for puberphonia over. So you have different therapy techniques like confidential voice therapy, resonant voice therapy, vocal function exercise, then accent method voice therapy, LSVT, respiratory retaining, all this are there. So we'll not go in detail. It will not like, as sir told, only Boone give 32 types. So reading it will not make any use. This is another one classification for exam purpose. Stemble give 2005. Vocal like hygienic voice therapy, symptomatic voice therapy, psychogenic voice therapy, and physiological voice therapy. So these are the basic for changing the voice. So one thing always you should remember is, like in voice, which part is responsible for pitch? Pitch, length of the vocal cords. So if any patient comes to you with pitch change mechanism or any problem related to pitch, so your therapy technique should be related to the vocal cords. If the patient is coming with intensity or loudness problem, then it should be loudness or intensity, which area is responsible? Pharynx, resonance, all this. So your technique should be based on the pharynx and cavity. So can you tell why two people will not have same voice? Resonant cavity, then structure. Is it all same or different? Different. So that is why we tell voice is the second identity after face, because everyone it is different. So that always you remember. If there is having like breathing, like they are not able to sustain for long time, you should go for which one? Respiratory training. Okay. If the problem is related to pitch related, your training or your therapy should be focused on the vocal cords. If the problem is related to loudness, vocal tract, or like phonatory and resonatory. These things always you remember. Don't mix up your techniques. Like for problem is in the larynx, you give them 100 loudness changing mechanism. Will it work out? No. So one is there, exploring the best pitch, then respiratory training, pushing approach, and lumbar. This is all basic. So we'll start with chant talk. What is chant talk?
Speaking in a very slow manner.
No. Chanting, all of you do, no?
Sloka.
My name is Kalpana.
No. All of you do Om. That's it.
Oh, the chant talk in parents.
Chanting, no? Om, Om, Om. Ah.
That's right, chant talk. If you have to chant, you.
Ah? Which is for Indian context, Om is easy. So we are not in Europe, no? So it is okay, no problem. Understood? So in Indian context, chant means what? Om. Understood? Yeah. Any. So start. So you just read once, and all of you start demonstrating. So now all of you tell your name by chanting. Continuous. No more. Om, 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 om. Like that, you have to start talking. Try everyone. Again, you should remember your pitch should be same. Ah, sir.
I really don't know what is the uh, rationale or the
It is there, sir.
background of this particular
See, it
method.
encourages the easy flow of phonation, reducing the tendency of hard glottal attack and increased force of vocal cord contact.
There is also one more technique where you are doing chewing, no?
Chewing is also there.
Yeah, chewing and chant talk have the two similarities. See, basically these are for doing stress, tension in the neck muscles, tongue muscles, and other things. So to loosen out and produce
Yeah.
easy flow,
Easy flow.
that is it. So any method of doing it, chanting in terms of not only any sound, you take any sound which is relaxing to your system. So with that you are going to initiate the talk. So this will prevent from having a hard glottal attack. So that glottal attacks is one thing which is very important,
Yeah.
underline that. If you can mention, it will solve the problem.
What is hard glottal attack?
Breaking or the causing the stop in between when you're talking.
No, 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 no,
No.
no.
Third years. Should I call the names?